most prostate cancer patients are treated with radiation therapy. There's a technique called intensity modulated radiation therapy where we modulate and sculpt the radiation beam from multiple angles to try to maximize the dose to the tumor while sparing the normal tissue around it, the rectum and the bladder. And so this is a mathematically complex problem to solve to avoid the normal tissue, to maximize this dose sparing. So what we're interested in is this problem is patient-based. So each specific patient comes in with their geometry and needs to have their treatment plan customized for their course of treatment. And what we have to do is this process is done manually, and it takes about 4 to 6 hours per patient. What we'd like to do is not only maintain the same quality of how we maintain this dose sparing, but we also want to reduce the time for treatment planning.
There are a number of elderly male patients who are going to have prostate cancer over their lifetimes. It's on the order of a large percentage of patients. So the idea is, if you want to give them all quality care, then there's no way to do it if they go to various community centers, unless you have some way of exporting information from educational centers to community centers. And we feel that the best way to do that is by using our knowledge database and somehow being able to look at a new patient and transferring the information from the knowledge database to this new patient. And in that sense, you would then have expert physicians' knowledge from educational institutions transferred to places like the community. And the idea is you're ensuring that those patients get treated to the best extent possible. So the way a physician would use this is they would look at their own patient on the system. And the system on the same screen allows you to view other patients who are similar and to be able to put their plans onto the new patient, and thereby look to see to what extent of sparing can be achieved for the rectum and bladder. And it also allows them to select between these candidate patients who are used as the matches from among the best. So you might have, for example, five patients who are the best matches. And from those 5, the physician can actually check to see which of those 5 best suit their own particular needs. So it could be that some physicians there are quirks between physicians, like some might think of patient 2 as better than patient 3, even though in some sense they're all fairly similar, but it kind of allows them to choose between very good candidate patients to match the new patient.
So this has been a project that's been running for several years, and RENCI actually came in at a really critical juncture when we were trying to take it from a basic idea and start to manipulate really large amounts of patient data, several hundred cases. This data involves primarily computer tomography, CT data, and this data needs to be visualized from many different angles. Typically in prostate cancer at Duke, we use 7 different treatment angles, so you can think of it as 7 different perspectives on the data. And in addition, we also need to handle a large amount of information that's associated with that data, including treatment parameters and the resulting treatment plans. So we were basically faced with this really daunting challenge of how to handle all this information, how do we visualize it, and how do we come up with an interface that we can use to show our resulting plans to the physician and demonstrate that, look, we actually have a improved treatment plan here. So thanks to RENCI's support, we were able to come up with that interface to look at all this data and actually present our results to the physicians who are the end users of this system. One more thing that it would also improve is accessibility. Because we are able to consistently deliver this high quality, you don't have to come to a top academic institution like Duke in order to get these kind of top quality plans. So this would probably help with rural or underserved areas, possibly even third world countries where the technology is available, but not the experience and not the time in order to make these high quality treatment plans. So using a tool like this, you're really leveling the playing field, and these sites that normally would not have access to this kind of high-quality treatment planning, now those patients would be able to benefit from this as well.